If you're watching this program, you probably have a person, or maybe if you're a healthcare provider, many people in your life who are living with dementia. By reaching out for resources, you've made a critically important step towards improving your lives by realizing that you need a team on this journey. So congratulations. My name is Melanie Bunn. I'm a registered nurse and consultant with Alzheimer's North Carolina. This program is focused on helping you identify resources that might be helpful to you in understanding, coping, and managing life with dementia. We have a wealth of resources in North Carolina. So whether you have a specific need, how do I get transportation? Or whether you're at the point where you're overwhelmed and confused and you don't even know what it is you need, you should find some answers here. Throughout the progression of disease, care partners need accurate information and education about the disease, dementia-specific support, and resource and referral sources. Some organizations provide all three, and some focus on one aspect. We're going to begin to talk about some of these. Carolina Memory Care Net is a wonderful resource for you. That's how you found me. Go to Carolina Memory Care Net for information, for resources, for education, specifically to Eastern North Carolina, but could be helpful for anyone. There are really three groups that you can go to find your point person. Alzheimer's North Carolina is a North Carolina-based organization that keeps resources specifically in North Carolina. They have educational programs and workshops. They provide support groups. They provide information and referral and provide respite care. The second organization I'm going to mention is the Alzheimer's Association, which has local chapters in North Carolina. While their primary focus is on research for a cure, they also provide education, caregiver support, and information and referral. The third organization, the North Carolina Department of Health and Human Services Division of Aging and Adult Services, is a critical organization because that's where you find the Area Agency on Aging. They are organized by counties, so the information there is specific to your community. And that's where you go to find your family caregiver specialist. Your family caregiver specialist is truly the expert in local resources. Who is it you call here? So, a helpful hint is to choose a point person from one of those three organizations to be your person to help you through transitions and as things change. Project Care, or Caregiver Alternatives to Running on Empty, is a specific program through North Carolina that is focused on helping caregivers care in a successful way. They provide information, education, resources, and actual respite and other kinds of caregiving sources. It's worth mentioning Dementia Capable North Carolina, which is the state plan for Alzheimer's disease in North Carolina. They also are very involved with dementia-friendly communities. For example, the Outer Banks Hospital has done training throughout their hospital about how care is different with people with dementia to make it better. Communities are embracing people living with dementia, including them in their communities instead of keeping them separated. If all of this is confusing, take a deep breath and let it go, because there also is an organization called NC211, which is a no wrong door organization. This is where you go if you know you need help, but you're not sure which agency to go to. You access a person who can say, oh, the group you need to call is this. So it's a person who can help you sort through all of the abbreviations and all of the language to find who you need to help you and your person living with dementia. ADEAR is another organization which has wonderful publications specifically about Alzheimer's disease, about dementia, that you can download and print or that you can order in multiple copies that are evidence-based, research-based, and interpretations of research in language that makes it understandable. Critical to being a successful caregiver is developing a network of support. There's some things that are universal about what you need from that support person or that support group. You need them to understand dementia, You need them to understand families and family systems, because dementia is different from other conditions, and it changes a family in many ways. It can either bring out the best in families, or it can bring out the worst in families. And a big part of which way it goes is how you take care of yourself and how you understand and improve your communications with the other people in your team and your network. So one option is support groups. Now, I have to admit I have a bias towards support groups. I volunteered as a support group leader for about 30 years, so I'm pretty committed. Alzheimer's North Carolina has those. The Alzheimer's Association chapters provide those, as do the area agencies on aging. They have different focuses. Some of them focus on helping the person who's living with dementia. Some of them are available for caregivers. Some of them are specifically for different types of dementia, like Lewy body dementia or frontotemporal lobe dementia or Alzheimer's disease. But all of them provide opportunity for support from people who get it, education, local resources that are specifically to your community, and opportunity to problem solve with people who have a real understanding, an insider's view. Therapy is a good option for many people and can be provided through a number of different professionals: healthcare professionals, mental health professionals, counselors, clergy can do a good job working with you and or the person living with dementia. Again, it's critically important that this person not only knows how to counsel or be a therapist, but understands dementia, understands families. We also have a growing online community. Now, one of the things that's unique about the online community is it can be very flexible, and it can also offer an opportunity if you're dealing with an unusual situation or an unusual condition to really access other people across the United States who have your same kind of issues. Care management is an opportunity to work with a professional through the Alzheimer's Association, through Alzheimer's North Carolina, through your area agency on aging, geriatric care manager, to really anticipate, plan, organize care. We're going to spend a moment talking specifically about the process of getting diagnosed because it makes a difference. Early diagnosis gives you the chance to involve the person living with dementia in their decision making, in their care planning, and have them make some decisions about what is most important to them. Your point person can be the person you go to identify the right healthcare provider for you and the person living with dementia, and strategies to help the person go to that appointment. Planning, because sometimes you only get one chance to do things right. So thinking ahead about legal issues, financial issues, insurance issues, gathering your care team together, and thinking about what are those critical conversations and who do you work with, your point person, to figure out how to manage those. Future planning from a legal and a financial perspective is important that you work with somebody who understands aging issues, dementia issues, and North Carolina issues. The National Academy of Elder Law Attorneys and the Legal Aid Society of North Carolina are places to start. SHIP is not going to take you off for a cruise. SHIP is actually Senior Health Insurance Information Program, and they provide free counseling and information about health insurance, about Medicare, about Medicaid, about who covers what, under what circumstances, and when. They are the experts. When you're gathering your care team, you want to think about who needs to be on that team. Some people cause more trouble than they're worth. Some people really get it and really should be there. But think about people who are good at different things, who understand dementia, understand your specific, unique situation. Family, professionals, churches, friends, people in your neighborhood can be part of this, but choose them wisely from their understanding of dementia and your life. In times of transitions, because dementia is a progressive disease, things that are working at one time might not work later on. Think about where you might reach out to. Some people do well at home with help coming in. Some people do well at home, but going out to something like an adult day program. Assisted living or nursing facilities are appropriate for other people. Wherever you go, you're thinking about safety and you're thinking about comfort. And here's a good resource with this caring home. The approaches and the strategies and the specific kinds of recommendations they make can be used whether the person lives at home or whether they live in a group setting. Falls are a risk for people living with dementia, so an evaluation from a rehab professional is a good option, as is a program to deal with what we don't ever want to happen, which is when we get separated. Two options. The Safe Return program is a registry program. Project Lifesaver is actually a monitoring program, and they can actually use radio transmission to locate the person should they get separated. Towards the end of disease, there are options that can be helpful. Palliative care is an option for people living with dementia, changing the focus from getting better to comfort. And at the end of life, hospice is a good resource for people with dementia. I mention hospice specifically because often we may not think of hospice for people with dementia, and often we get them involved too late. Lastly, even though dementia can be overwhelming, and even though the resources can be confusing, when you develop a relationship with your point person, when you ask questions and you keep asking questions until you find the right person with the right answer, and you take care of yourself through the process, you can find some joy in the journey. Thank you for listening.